Welcome back. Now, November is Diabetes Awareness Month, and NGO Health-e News has been providing Morning Live with a series of inserts about the effects of excessive sugar consumption in patients. This story is about as dramatic as they come. Their case study, Manie Pretorius, a former army employee and sportsman, tells us his story. So severe, it ended up in him having to have a gastric bypass surgery. Take a look.
There's always circumstances that lead to obesity. It's not one day you just wake up and decide, I want to eat and I want to be fat. When I joined the National Defence Force, I weighed 74 kgs. I was a sports person before. I had a knee injury, cross ligaments. I had 11 operations on my knee. And gradually I picked up weight up to a certain stage where you just realize it's too late now. Life is very difficult if you're overweight. First of all, I lived on painkillers. My back and my knees couldn't carry the weight anymore. Or the biggest problem for me was I couldn't give my experiences over to my kids. I couldn't even properly go for a walk with them. I was diagnosed with diabetes. 2 months later, I was class 2 diabetic on insulin. Dr. Stapleton, I was referred to him, and he was dead honest with me. He said to me he's willing to put a year's salary that I will not reach 50 due to my cholesterol and my diabetes. There was a lot of risks on the table. The procedure basically I had is a gastric bypass operation. They staple part of the stomach.
When he first came to us, he was pretty close to 200 kilograms. We've seen an explosion of obesity in the last 20 or 30 years, and an explosion in type 2 diabetes concomitantly. Food is much more abundantly available. We used to get as children 40 or 50 years ago. It was a small little bottle, and our parents would give us one bottle as a treat, maybe once a week. Now everybody's got 2 or 3 2-liter bottles of their favorite soda in their fridge all the time. And the important thing to understand is that obesity is a disease. There's the association between obesity and a group of diseases like high blood pressure, diabetes, fatty liver, high cholesterol, which leads to arterial disease, which leads to heart attacks, strokes, kidney failure, blindness, etc., etc.
The decision was not easy. There is obviously a lot of risks with the operation. But I've talked to my family and we decided that that's the right thing to do. I'm glad I did it. My diabetes is gone. My cholesterol is also under control. I was using 42 tablets a day. I'm currently on 3, which is an iron supplement and a multivitamin supplement and half a spoon, and that's it. It's hard work to lose weight. There's no magic cure. There's a lot of adverts and stuff. You just take this medication and fat will disappear. It doesn't work. This operation that I had is not a magic cure. There's people that had this operation that is still as big as they were before the operation. It's just a tool. You must still help yourself.
Thanks to Health-e for that dramatic story.